Hello, my name is Haley Shugart. I am one of the clinical research coordinators and CCRPs at Thomas Jefferson University Hospital. I'm here to present the abstract entitled Opioid Medication Use and Cognitive Function in Older African American Patients with Diabetes. For the background and objectives of our project, we were looking at a specific population of patients that were older African Americans that had diabetes, and we were looking to see what types of factors might affect their ability to manage their diabetes. We saw some studies that showed that opioid medications were associated with cognitive decline, where some studies even indicated that higher doses were related to even higher cognitive decline. However, there were some mixed results in some of the studies where the results were inconclusive. So we wanted to specifically assess whether opioid use in this specific population of patients was associated with lower cognitive function or greater impairment in their activities of daily living, or ADLs. For definitions, we defined opioid use as having a prescription with patient-reported usage of that prescription. We converted the dosages to morphine milligram equivalents just so that we could have a standardized dose across all patients, regardless of the type of opioid that they were taking. For cognitive function, we measured this on a 16-point short-form Montreal Cognitive Assessment, or SMOCA, and then for ADL performance, we measured this on a 45-point survey that rated patients' ability to perform their given activities. A higher score on this measure indicated a better functioning in their ADL performance. For methods, we looked at a secondary analysis of a larger randomized controlled trial that included African American patients with diabetes that were 60 years of age or older. The primary study was looking to assess a community health worker-based intervention in its ability to help patients better manage their diabetes. These patients were enrolled in 2 urban emergency departments in Philadelphia, and a baseline assessment of data was collected from them prior to the start of the intervention. This baseline data assessment included things like active medication lists that were collected by emergency department staff to confirm that the patient was taking them. There was also an ADL assessment as well as a cognitive assessment with the SMOCA. In this population, we know that patients might have all different types of factors that could contribute to their ability to manage their diabetes, and we wanted to see what types of factors might be contributing to that. So our primary outcome was looking at the association between opioid use, cognitive function, and the ability to perform ADLs. The type of statistical analysis that we used was a one-way ANOVA and a Pearson correlation. For the demographic data, in the larger randomized controlled trial, there was a total of 214 patients. They had a median age of 66 years old. They were 25% male, and then out of that total number of patients, there was an active opioid prescription percentage of 20%, so a total of 43 patients were taking opioids. For some of the data, the SMOCA score, there was a median of 9 in these patients out of a 16-point scale. For morphine milligram equivalents, there was 7.5 milligrams was the median for the patients that reported taking opioids. And then for ADL scores, there was a median score of 38 out of the 45-point scale. For our results, we found that there was no statistically significant correlation between MME and SMOCA or ADL scores. There was also no significant difference between the SMOCA and the ADL scores when we compared patients that were taking opioid medications versus those patients that were not taking that type of medication. We also found that there was no correlation within that group of patients taking the opioids between the amount of opioids that they were taking and their SMOCA or ADL scores. However, there were some limitations. Even though the sample size of the randomized control trial was fairly large, there was only a small sample size of those patients actually taking opioid prescriptions for a total of 43 patients. And even though we did have the dose that the patient was taking of those opioids, we were not able to account for the length of time that they were taking this medication. In conclusion, we know that older African American patients with diabetes, their cognitive function and ability to perform their ADLs can potentially affect their ability to care for themselves, their diabetes, and any other medical conditions that they might have. So specifically in our population, we found that opioid medication use, even at high doses, doses was not a risk factor for worsened cognitive function or impaired performance in their ADLs. Thank you.